Hello, I'm Diana Hodgins, the founder and CEO of GateSmart.
And I'm Emma Debbage, Practice Manager at West Street Surgery and also PCN Manager of Chiltern Hills PCN.
We're going to talk to you about our AI tool, GateSmart, and how it's been introduced into primary care. I'm going to talk about the science and the AI of the tool.
And I'm going to be talking about how GateSmart has been embedded into our Keeping Well frailty pathways.
It's a system that is used to measure walking and help people improve their walking. Walking seems very simple. We do it all day, every day. But the trouble is, if we don't walk correctly, particularly as we get older, we put ourselves at risk of frailty, falls, osteoarthritis, and just general loss of independence. Walking is basically we move our hips and we move our knees. And the reason we have to do this is to keep ourselves stable when we walk and to make sure we don't trip when we move our leg under our body. If we look at the graph of a hip and knee movement, we can see that we should extend and flex our hip about the same amount. And the reason is that that gives us a very stable base. So we have a good isosceles triangle. Our knee, we bend it when we load it, and we bend it when we move under the body. The bending when we load does two things. It keeps our center of gravity at about the same place, and it takes the impact from the heel strike out of the joints. When we walk and we bend the knee in the swing phase, it has to be bent sufficiently so that as it comes under the body, it doesn't catch things on the ground. So this seems sensible and very simple, but actually measuring it is extremely difficult. So we do this by using inertial measuring units, which we mount on the pelvis, the base of the spine, the thigh, and the calf on both legs. And we can measure the sagittal plane, which is the important plane of movement, and also the out of plane movement. By doing this, we can measure and actually quantify the range of the hip joint, the knee joint, and the segments that make up the hip and the knee joint. So we put this as a GateSmart score, making it very simple for people to understand what their range is and where there are issues, if there are. And this is an example that you can see. We present it in a simple visual for the person that's being measured. The system, and we will see later it being used, but basically we use 7 sensors and we provide one as a spare. The straps go on over clothing to make it nice and simple, and you can measure anyone in any environment. The tablet is the local connection, so it's Bluetooth to the tablet and then Wi-Fi out. And all of this comes in a case. So the thing is that you can take this case and use, as long as you've got a connection, an internet connection, you can measure anyone, anywhere. So this is an example. You can see the straps on the clothing, the communication to the tablet through the app, and then this data is loaded up to the cloud. All the calculations are done in the cloud, which means that the person doing the test doesn't actually have to be an expert in gait kinematics, sensors, or any other analytical methods. All the data is stored there and calculated, so we can look at the reports anytime in the future. So this is all sensor-based gait kinematics. But the next stage is working out exactly how this data can help. So we've worked out, and we can tell somebody where the issue is, but that really is only half of the story, because this person needs to be able to put it right. And how do you do that? Well, we use this GaitSmart data, and we do inverse kinematics. So we actually work out what muscle movement would generate that gait movement. And then we can look at the muscle, all the 96 muscle groups, and we can look at that compared to a healthy reference. From that, we can work out which muscles are weak. Now, we don't put that in the report because that's too much data, particularly for an older person. They just want very simple data. This is what's wrong, and this is what you're going to do about it. So now we're going to play a video, and we can see how we actually generate that movement. And as you can see, we can get a person walking across the room virtually. Now, that's quite a challenge. The data's got to be right, otherwise the muscle movement would be incorrect. But we can collect all this and do this from our data. So then what's the next thing? So we've worked out which of the muscles aren't working as we would expect. We can then say, okay, but there are a lot of strength and balance, and they have to be strength and balance exercises, because when you walk, you are loading, your body weight goes through your legs. And this is why typically when an older person is sent to strength and balance exercise classes, it's because they need to have balance and they need to have strength to be able to walk. So we model all the standard strength and balance exercises that everybody's very used to, but basically they're part of the gait cycle. So you're always standing for 80% of the time, you're on one leg or another, and that's important to look at. So we model this, and as you can see, this is an example of one of the strength and balance exercises. And we can work out which muscles are being used. Now, all of them will be used a bit, but which ones are strongest? So then the AI, this is a whole AI-driven solution, because it actually is embedded into the end report. The person being tested, we've modeled their walking, we know what muscles are weak, we've modeled all the strength and balance exercises, and from that we can then work out the best set of 6 exercises to address the muscle deficiency. And we chose 6 because there's obviously there are a lot of different muscle groups, so we've focused on the important ones for that person. We don't give them the book of exercises, because in which case it would be completely useless, and we don't give them one because that's only going to work on a very small set. So you can see here, this is an example of 6 exercises that are given to the person. And that is where the AI-driven part of our solution is embedded. It addresses their gait deficiencies. it offers them balance exercises, and it makes the legs work and the core. So we mustn't forget, when you're standing on one leg, the core has got to be strong, because center of gravity is between the legs, and the core has then got to be able to hold the hip joint steady. So this is all important. So we can look at this. We have many thousands of people's data, which is by far and away the biggest data set for gait kinematics in the world. And we can see how these kinematics change and what is healthy movement as opposed to non-healthy. So if a person's walking and they're completely healthy, every parameter will be in green, and that all the scores will be 100%. Now, we look at the pelvis. That shouldn't move, because you're meant to move from the hip joint. The hip joint and the knee joint are the fundamentals of walking. But we also have the thigh, which theoretically should be very similar. If the pelvis isn't moving, there's no rotation. The calf actually shows very clearly whether or not the leg is coming behind. And often this is, the calf muscles become weaker as you get older. The stride time is a gross metric, but it tells you there's something wrong. If it's below 1.2 seconds, that generally suggests it's a healthy person. If somebody has a problem, they slow the stride down, it's either pain or the lack of strength to be able to move them forward, so everything's very much slower. The Gait Smart score shows side-to-side movement of the thigh and the calf, so the coronal plane, and the stance flexion. That, again, is important, because if you can't flex those knees on load, it means those knees are suffering. And symmetry, despite what people say, we are symmetrical. We walk symmetrically. We may move our upper body, but we certainly do not have a different movement for left and right legs unless there is a problem. So obviously, once you can have color coding, it's very quick and easy to see. You need no knowledge of kinematics. You just go with this example. The left hip is causing big issues. The left knee is causing some issues, and the left calf isn't moving back. So the whole left side is not moving correctly. The stride duration is very slow. So there is a real issue. This person has a major problem. But their knee flexion on load is just acceptable. So the quality score, there's no outer plane movement. It is purely they cannot move sufficiently in the sagittal plane. And the symmetry score just quickly highlights it's the left side. Negative means the left side's lower. So somebody getting this report can understand very quickly what the problem is, how bad it is, and that's their baseline. So the important thing is we can now get this better. This shows tests being done.
And then this goes on your right calf.
This gives an example of somebody improving. So we have the first test. In this case, you can see it's the right knee that's an issue. But everything else is weak, because once you can't walk properly, all your muscles will reduce. And then we go, second test. the other muscles are starting to work. So the focus now is on the right knee. Third test, it's getting better. The right knee's got a amber border and the calf is higher. And the fourth and final test is amber. So the thing is that we can see here, we've got these movement and the patient, the person can see this.
Thank you, Diana. At West Street Surgery, we weren't looking for more technology, but we were looking at ways to keep our patients stronger, mobile, and living independently for longer. But when we were lucky enough to be offered the opportunity to trial GateSmart AI technology, we jumped at it. Over the past 3 years, we have developed a proactive frailty pathway called Keeping Well, working closely with our secondary care colleagues. Today, I'm going to share how we embedded GateSmart into that pathway and what impact it has had for our patients. Frailty is often identified only after something has already gone wrong, a fall, a fracture, or a hospital admission. In primary care, we see patients regularly, so we felt we were in a unique position to identify mobility decline earlier and intervene before crisis occurs. Our aim was to move away from reactive care and towards prevention. For the past 3 years, we have been building our Keeping Well pathway, a collaborative approach between primary and secondary care. We run weekly Keeping Well clinics with a multidisciplinary team which reviews patients proactively. The team includes care coordinators, pharmacists, GPs, frailty nurses, and our secondary care geriatric consultant and her specialist nursing team. The goal is simple: to support older patients to stay well, stay mobile, and remain living independently at home for longer. I'm sure that you all know the benefits of walking, and our clinicians at West Street Surgery regularly prescribe walking. But if you can't walk far or you're too scared, then there's no benefit at all. Our aim is to keep people walking for longer. It offers so many health benefits, from reducing the risk of osteoporosis to increasing blood flow and brain function. And of course, at any age, it hugely benefits your mental health. Risk stratification has been a key part of this work. We use population health tools and frailty indicators, and more recently we've incorporated the Johns Hopkins risk stratification tool. This helps us identify patients who are most likely to benefit from proactive intervention. Once identified, these patients are invited to our Keeping Well clinics for further assessment and support. This is where GateSmart became very valuable. It allows us to objectively assess mobility and detect movement imbalances that might otherwise be difficult to identify in a standard consultation. Patients complete an assessment and are then offered a 12-week program designed to improve their strength, mobility, and balance. We then review them again through follow-up recalls at 3, 6, and 12 months to ensure progress is maintained. Importantly, patients can actually see their progress, which helps motivate them to stay engaged. Since introducing GateSmart, we have offered assessments to over 232 patients. 134 patients have completed the full 12-week program and 26 are close to completion. Those patients are brought back for regular reviews in our clinics to monitor their progress and ensure that improvements are sustained. This has allowed us to integrate mobility monitoring into routine proactive care. What has been particularly encouraging is the measurable improvement in mobility. Around 80% of our patients showed improvements in gait stride and walking speed, important indicators of overall mobility, which are closely linked to future frailty and falls risk. So having an objective way to measure improvement is incredibly valuable for both clinicians and patients. This slide shows the results from the initial and final assessments. As you can see, many of our patients had significant walking issues at the start of the programme, the dark blue bars. Issues that they had would impact their health and ultimately their independence. And as you can see, only 8 were considered to have a healthy, acceptable gait. Following the 12-week intervention programme, you will see the dramatic impact made, the light blue bars. And at the bottom, you can see that 38 patients were now walking healthy and there was also significant progress made in each of the categories. GaitSmart has had a significant impact for us as a practice, but its introduction in healthcare settings up and down the UK will have the best impact for the NHS as a whole. GaitSmart offers the opportunity for preventative care to be delivered locally or within neighbourhoods, and it fits perfectly into the NHS's long-term plan of proactive care and digital intervention. But the most powerful outcomes are often what patients tell us. We frequently hear patients say they feel stronger, faster and more confident when they're walking. One patient has told us that they have even put their walking stick in the back of the cupboard. The moment really captures the difference this approach can make to independence and confidence. When technology shows patients tangible improvements in their mobility, it stops feeling like AI and simply becomes part of their normal day-to-day care. The colourful reports are easy to understand, and the individual exercise plans are simple to follow and can be carried out anywhere around their home. Some of the comments that some of our patients have made are that it helped me knowing that I had exercises to improve my movement and they were specific for me. It definitely helped me in the garden, whereas previously I had difficulty getting up and down. It's improved my walking, and most importantly, it's helped me stay more active. I feel that anything that helps me to be more active is in my best interest. What's exciting about GaitSmart is this approach is now expanding beyond frailty. We're beginning to offer GaitSmart to younger patients, particularly those experiencing mobility issues earlier in life. It's also been very useful for patients waiting for physiotherapy, helping them start improving their mobility sooner. Interestingly, we've even had a number of teenagers requesting assessments, particularly those that are trying to improve their movement or recovering from injuries from football and rugby. This shows the potential for this technology to support mobility across a much wider population. Primary care sees patients long before frailty develops. By combining proactive care pathways with technologies like GaitSmart, we have the opportunity not to just treat decline, but to prevent it. And when patients tell us they feel stronger, faster, and more confident, we know we are helping them stay independent for longer. And ultimately, that's what AI technology in healthcare should be all about.
Thank you all for listening, and we hope you found this interesting. If you'd like to know more about GaitSmart, please follow the QR code.
Thank you.